name is Kimberly Allen, and I'm here to talk to you today about the role of peer recovery and family support in optimizing integrated health outcomes. This is segment 4 of 8 segments. Today we're going to talk about managed care organizations, better known as MCOs, and I will walk you through this process about how managed healthcare is using peer support and family support today. This project is part of Texans for Recovery and Resiliency. TRR is a SAMHSA-supported collaboration between the Family Mental Health Network, which is the Texas Federation of Families for Children's Mental Health, and the Addiction Recovery Community statewide network, RecoveryPeople. The purpose of the collaboration is to strengthen peer and family voices in mental health and substance use recovery, policy, and program development. So when we think about managed care organizations, we often think about cost containment. So MCOs are interested in containing cost on patients with mental health and substance use conditions, as well as work in quality improvement. So if you work for an MCO, you may be thinking about high cost, which includes high risk, high-need patients. And I spoke with an executive at a large managed healthcare company, and he talks about what caused them to use peers. What we found in terms of a problem area was hospital readmission. This was one area we decided to hit, transitioning people into the community so they could access proper support and connect with community resources to sustain them, and then to address important parts of learned behavior. So this managed healthcare company was seeing hospital readmission on persons that needed treatment for mental health and substance use disorder. This was measured by them. They knew that they needed to transition people into the community. When he talks about learned behavior, he's talking about being able to learn new behaviors to maintain wellness and not go back into the hospital. So this is something that was of chief interest to this MCO. This is another managed healthcare organization. We knew that we needed to sustain their treatment and sustain their recovery outside of a hospital setting. They kept going into the hospital, so we tried to offer outpatient and work with providers and managed health clinicians to offer benefits that we could not offer under the benefit plan. We found we were in need of additional services to support community tenure to keep someone out of the hospital. So what that means is that this managed healthcare company knew that people were going in and out of treatment into hospital settings, and they tried several things. They tried offering outpatient services. They tried working with those providers. They tried working with clinicians. And what they were trying to do was offer people with mental health, behavioral health conditions, benefits. They wanted to provide support that is not offered under typical insurance benefit plans. So they knew that they were in need of additional services to support people in the community and keep them out of the hospital. This was very, very expensive in the insurance community. It was measurable. People were not getting better, so they needed a solution. Once again, this was yet another context. I talked to multiple contacts within these managed healthcare organizations. Certainly, I spoke with executives. I spoke with people that recruited peers. I spoke with people that trained peers. This person said, what we found in terms of a problem area was hospital readmission, and one we decided to hit. Peer support helps people transition into the community so they could access proper support and be able to connect with community resources to sustain them. So you really hear the same thing over and over. The managed companies are aware of hospital readmission. They want to hit those areas. They want to focus on those areas and help people transition into the community so that they're supported. So this is something that they are interested in. This was an interesting comment from a major leader in managed health. Stigma affects us in ways that prevents us from accessing community services. To have someone appear to help guide us is so essential. So he's talking about a peer role that he views as essential, which is very true. We do help guide people into accessing community services. We don't tell people what to do, but we certainly help them access care that they have voiced, that they want and need. So there you go. So when asking about peers and asking if managed healthcare actually uses peers, a leader there in one of these managed healthcare companies said, we do have examples where we use peer coaches to support our commercial lines of business. Peers work in recovery and resiliency departments and collaborate with clinical teams and hold joint meetings. So when he talks about commercial lines of business, this is private health care. This isn't lines of insurance that is through the government. Rather, it's what's known as a commercial line of business. So you can get it at your workplace, for example, and it's a commercial line. So that's what they mean. So internally in managed health, they've got departments to serve these lines of business. So within the recovery and resiliency department, which is what they call it, they do have peers working in those areas. So these are certified peers. They are working there. Those peers do collaborate with clinicians. They meet together and they discuss patients, they discuss individuals, and figure out what they can do to help people access community resources and actually recover and improve. They have internal peers. They have external peers that support insurance lines of business. That's the commercial lines that we just talked about. That the health plans also contract with peer support entities throughout the country. So you may see them using peer coaches. That's yet another title that peer supporters have. You may hear peer navigator. You may hear peer coach. You can hear different titles depending on where peers work, but they do work in insurance, and they also contract with peer support entities. So those are networks throughout the United States. This is a quote from a peer leader inside managed healthcare. I think our dedicated peer recovery and resiliency department within the company was spurred by clinical teams who were experiencing challenges trying to support our members that required additional services not typically covered under commercial benefit. These are members with severe mental illness. We kept seeing multiple readmissions. Okay, so this executive is talking about the Peer Recovery and Resiliency Department, and that's where the peers are. And what he's saying is, how did that department start? Well, it was started by the clinical teams who worked within clinical areas, and they had challenges. They were trying to support members. Members means who's covered by insurance. So they were trying to support people that needed additional services, but those were not covered under commercial benefits. So you may know about that. You may have a benefit plan that covers medical, it may cover vision, it may cover things along those lines when you go to the emergency room, but you need more. You know, you're fortunate if it does indeed cover mental health, but you still need more to go out into the community and to stay well. So these clinical teams, we're saying that we see these members, we see these people. They are talking about severe mental illness in this particular example, and they're just saying that we kept seeing multiple readmissions. So they started spurring the need and saying, what can we do? So the managed healthcare company set up a program to help work with people with severe mental illness. And nowadays, they work with people who they sometimes may call the worried well, people that have a lot of stress, that are attempting to stay well. And this is how it works. There's a referral that's made through a web-based system. So the individual may call in or go online and say, I am stressed, I feel depressed, I am having an issue. And the managed healthcare company is notified of this. They know that someone's calling in that has a mental health issue. It may be a substance use issue, and it may be something serious. So they contact the member, the individual that's covered by insurance. They ring them back, or they write them back on the web and say, how may I help you? The issue is reviewed, and then community support is introduced to this member. So this may be in combination with clinical help, but right now we're just talking about community support. So the managed healthcare company says, let's talk about that. What's available in your community that can help you? So the peers are involved in this, and they provide support in this. They provide support face-to-face sometimes. They work via phone sometimes. They can use text messaging, or they can use the internet. So there are now a variety of ways that peers work in managed health environments as well as other environments. There are some peer programs that meet with families, and they work on family helplines. That's a little bit harder to find, but it does exist. This managed healthcare organization said, we also contract with several peer support entities throughout the country. So typically these are independent peer support groups that are throughout the country. So these are certified peers that have banded together, and they have these entities. And the managed healthcare executives said, we leverage our internal team, our peer recovery and resilience team, to help facilitate and identify peer support programs throughout the country. So they have internal clinicians, they have peers that work in recovery and resilience, and they do work for peer support programs throughout the country. Interestingly, I have worked on one of those peer support programs. I really enjoyed that. It was a telephonic program, and I supported members that were insured through an insurance company. Most peers meet face-to-face, at least 4 contacts per month. They have they have at least 4 contacts per month. 2 of those are face-to-face, and the internal ones are telephonic. So this is a managed healthcare company. This is the model that they use. They do have peers that do meet face-to-face. They have 4 contacts a month. So there you have it. It's more than I thought it would be. 2 of those are face-to-face, and the rest are telephonic. So I was very interested to see that in managed healthcare, at least at some companies, they do have face-to-face meetings. So I asked about families, specifically if managed healthcare meets with families, and the response, this was from a recovery and resiliency area. They're responsible for training peers, doing outreach for peers, finding peers that can help. Some of the more experienced peer programs will meet with families. The newer ones are not trained in that. We are continuing to think about that. So they're saying that the newer peer programs may not be trained in working with families. So they're still thinking about how they can work with family providers. We are considering adding family care. We are in the process of bringing on another peer support program that offers that. We would not ideally exclude this in a peer program. So this is a managed healthcare company that's actively considering using family partners, and they are in that process. They started that process. It was not in the state of Texas, but they are bringing on people that work with families. So this was really interesting. The result of using peer services. I got this from a leader that I certainly trust in managed healthcare. He said you can learn a lot from claims value. So this is where the managed healthcare company actually looks at the claims. They actually look at the dollars spent. You can see the monetary impact the peers have on the service delivery system. By having peers, we reduce the number of hospital days, reduce readmits, and other services. So we know that peers are involved in cost containment. Here's another managed healthcare company. By having peers, we reduce the number of hospital days, readmits, other services, and it is cost effective. So this is where we can actively measure the cost that peers save. Those actual reports are inside the managed healthcare companies. I do hope that we see more reports as we go along. If you'd like more information on the role of peers and family supporters in integrated health systems, please drop me a note at Kimberly Allen at RecoveryPeople.org. We have a website, RecoveryPeople.org, and we have Recovery and Resiliency.org. Thanks so much for listening today.